My name is Dr. Steve Powell and I am the Chief Diagnostic Officer at Rutherford Diagnostics. Rutherford Diagnostics is a subsidiary of Proton Partners International. Proton came to Liverpool quite recently and are building a cancer centre there. My background is in NHS radiology, in medical imaging, and there's a real lack of capacity in med imaging. And Proton had an ambition to provide some of that capacity to improve healthcare outcomes in the UK. If you compare the UK to its European neighbours, we are the poor man of Europe when it comes to medical diagnostic provision per person. And that's particularly evident here in Liverpool, where we're establishing our first centre. There are fewer scanners and therefore late diagnostics for patients, for individuals, is a real problem and leads to poor health outcomes. Let's start with cancer. There are 52,000 unnecessary cancer deaths per year in the UK because of late-stage cancer diagnosis. Now, we have the same drugs as our European neighbours. We have excellent healthcare provision in the NHS, but we are limited in the availability of diagnostics, and that's one of the contributing factors. So we're here to build diagnostic centres to allow the wide population to get access to what they need. The future of medicine is genomics. If you understand that disease is related to our genes and the way our genes interact with our environment. Now, obviously we can change environmental factors, we can smoke less, we can look after our weight, but our genetic predisposition is really important too. And at Rutherford Diagnostics we are building a genomics laboratory to be able to move from a health paradigm that is reactive from an ill health stance to really being in the prediction, prevention and earliest possible detection market. We provide additionality, not competition, and that's critical to our business model. It's equally important that we do partner with the NHS. We should not be competing with our National Health Service to provide diagnostics. Rutherford Diagnostics has been talking to many NHS institutions around the UK, but also healthcare institutions around the globe, and we've been well received. Right now we're putting in diagnostic facilities around the UK, and they will be meeting unmet demand for people today that are sick. Where we need to move towards is not that reactive health paradigm of responding to ill health, but keeping people well. And we see that being a process of genetic screening, understanding people's susceptibility, entering them into a personalised screening programme, and identifying disease at the earliest possible opportunity. Diagnostic tests, the demand for them grows year on year at a rate of anywhere between 10 and 20% depending on which diagnostic modality we're looking at. I mean, that's a rapid rate of change. To meet that, the number of scanners that are required in the UK are growing in the rate of tens, if not hundreds, per year. That's a huge investment that's required, and we are in a position to meet that investment. So the vision really for Rutherford Diagnostics is to change health outcomes in populations. I mean, critically important is changing something for an individual, but changing things across cities and across nations, that's a really big, important vision, and that's what we want to deliver.